Other statistic I want to draw your attention to, Dr. Kang, at the moment is the one that I led the program with, that Maharashtra is the worst affected state. Almost 60% of cases are coming from Maharashtra in terms of daily infections. Does that suggest some states are worse affected? Why Maharashtra in particular? What explains that?
I think we have to understand that the situation this year is very different from the situation last year. Last year, we had a completely susceptible population, and when the virus came in, anybody and everybody was available to be infected. We are in a situation now where a significant proportion of the population, somewhere between 20% and 50% of the population, in cities closer to 50 or over, in rural areas lower, people have already been infected. We know that prior infection does protect from the original version of the virus. So if I see large numbers going up in Maharashtra, it makes me think that there has to be something different here. If people are less susceptible, then it has to be that the virus might have changed, and we may have a variant of the virus in Maharashtra that's driving the surge. I don't think that we can do the one-size-fits-all explanation for the rises that we are seeing in different parts of the country anymore. It is something that will be driven by prior levels of infection, by individual behavior, by levels of vaccination, and by changes in the virus.
You are making a very important point there, Dr. Kang. You are telling me that A, there could be another variant of the virus possibly in Maharashtra at the moment. You're also saying that more than 50% of the population in the urban areas is already infected by COVID in some form. So some element of herd immunity has set in. Am I correct?
Well, herd immunity would only apply to the older variant of the virus. If this is a virus that is much more transmissible and gets into people, what you're going to see is a rise in numbers of infections, even in those who might have had prior exposure. But because we know that infection protects from disease, you may see a rise in the number of cases, but not necessarily an equivalent rise in the number of hospitalizations and in the number of deaths. That's why it's important to put multiple pieces of data together to create a bigger picture. And right now what we are focusing on is just numbers of cases rising and the the reduced number of deaths as compared to last year. And that can have multiple explanations.
I'm going to come to solutions in a moment. Let's come to you, Kiran Majumdar-Shaw, because you know, one of the solutions that is traditionally used is lockdown. And the concern is that if cases continue to mount, there might be another lockdown. Already we are seeing lockdowns in Nagpur. We are seeing night curfews in some parts of the country, localized lockdowns. Do you believe that lockdowns is not the solution? They will harm livelihoods. Is that going to be therefore detrimental? Would you therefore see lockdown as a bad solution at the moment?
You know, it beats me, Rajdeep, as to why the policy makers are really not interested in getting the economy opening up soon. Why is it that they don't understand that the working class and the workers ought to be under that essential workers or frontline worker category? Why is it that they don't want students to get back to colleges? I mean, it's just, you know, a no-brainer to know that these are the immediate group of people you ought to vaccinate. Because let's face it, the numbers are rising not because of the old and vulnerable. The numbers are rising because young people have become, I think, very, very, you know, impatient about, you know, staying quarantined or at home or restricted. They are becoming very carefree, they are becoming callous, and they are really sort of basically spreading the virus. So I think these are the people who need to be, you know, vaccinated, and we have to protect the rest of society. So I'm not surprised at the surging numbers, but unless you act, there's no point in another lockdown. You know, one good thing is that even if young people are going to be infected, we are still seeing that the mortality rates are still very low compared to what it was in the past. But we don't want to unnecessarily invite trouble. So I really think we should be safe rather than sorry. And the only way to do that is to vaccinate this particular level population.